Australia has been in trouble since 2020, and it has continued to this day. During this period, the virus spread rapidly. Many people in Australia fell ill, and the Australian government took steps to close the country. This practice has had a huge impact on its politics, economy, material, manpower, and many other aspects. A prolonged lockdown is not a good solution. How Australia moves towards the future in a world with COVID is what matters. According to the topic, we analyzed the following key points. What problems and opportunities has COVID created in the world? From this, we have summarized three main problems. The first is mental health problem. The data shows more than 2 in 5 Australians aged 16 to 85 will develop a mental disorder at some point in their lives in 2020-21. 1 in 5 suffers from a mental disorder within 12 months. In addition, 4.4 million people experienced a mental disorder at some point in their lives, but did not have a mental disorder for 12 months. The outbreak of the virus has also created anxiety among Australian teenagers, and the data also shows that teenagers are more prone to anxiety than adults.
I do have some friends that suffer from some mental health issues, and they do seem a lot more down now because of the virus.
I also have a friend who has some family troubles, and I feel like her stress has been amplified now that, with quarantine and stuff like that, not being able to see her also makes it worse because we can't really talk about it, and I can't really comfort her the way I would be able to if we see each other face to face.
Due to COVID-19, it has become difficult and time-consuming for people to go to hospital. And considering the safe distance of COVID-19, many people are afraid to go to hospital when they are unaware, which will delay people's health problem. And hospitals are in the short supply of facilities and staff in the event of a pandemic, which could reduce the efficiency of medical service. According to the research, emergency department patients wait more than an hour and a half to be admitted to the room and usually discharged several hours later. And long waits are required not only for emergency care, but also for regular medical process. Through the survey, we found that Australian hospitals have been under tremendous pressure from people. In general, as many as 100,000 cases was recorded every day, and the number of hospitalizations has been on record, leading to a shortage of hospital beds and service. Furthermore, we conducted quantitative research on people's experience of going to hospitals. There are a total of 23 people participated. We found that about 15% of people go to the hospital more than once every 3 months, and most people don't like hospital appointment process, and no one is satisfied with making an appointment to see a doctor. The reason may be that waiting time will last about 1 hour each time, and the longest waiting time is more than 4 hours. There are more than 18% of people feel that the process of going to the hospital is very complicated, including making an appointment and waiting for a doctor to get medical, which can make people feel anxious. About 17% didn't want to go to the hospital because of time issues, and another 20% were worried about catching other disease in a crowded hospital. So complexity and time consuming are the biggest factors in people's hospital plans.
This video is a comparison of the number of people in public places before and after COVID-19. This situation is partly due to government control and partly comes from people's concern for their own safety. Although the measures taken by governments differed, the way people protect themselves was clearly similar. They are going out less often and choosing to take certain precautions against the virus in public places.
Clean my phone or disinfect my shoes. Every time I come home, I take a shower immediately and toss my dirty clothes into the laundry.
I only go out once a week to buy food. When I come home, I make sure to wash my hands properly and to disinfect the products that I buy.
When we were traveling back from Spain, we were wearing these masks on the plane, on the airport and on the train. People gave us weird looks, but in the end I don't think we regret doing it.
These measures have worked well to help protect people from the virus, but they can also have some negative effects. This study shows that wearing masks in public places during COVID-19 may increase the tendency for aggressive and abnormal behavior, as well as feelings of alienation and loss. People's personal distance was increased, with increasing individualized treatment and gradual atrophy of public spaces. Of course, people want to go back to the way they were before COVID-19, without wearing masks and playing in public with friends, but they now have to choose to protect themselves. Max is a bank worker who is married and has 2 lovely children. He used to be able to take his children to the hospital without worry, but now he worries about getting the virus and waiting in long lines. According to the primary and secondary data we collected, we realized that people have a lot of concerns about the way and efficiency of going to the hospital. So we got the following problem statement to address the consumer persona. Max, married with 2 kids, needs a way to have a safer and more convenient way to visit doctors, because he is worried about catching the virus in public places and wasting a lot of time waiting in line and making appointments.
So we want to design an online medical application to solve the problem of people's difficulty in going to the hospital. First, we designed a storyboard. When a person is sick and he didn't want or can't go to the hospital for various reasons, then he can find a doctor online. The patient communicates with the doctor online, and the doctor prescribes the medicine according to the patient's condition. The delivery clerk then comes to the hospital to pick up the medicine and then deliver it to the patient's home. After we finished the storyboard, we found that there were some risks. The first risk is that patients may not trust the reliability of online medical care and are worried that doctors cannot accurately monitor their conditions online. The second risk is the difficulty of building an online platform. The third risk is that it may take a long time for the delivery person to deliver the medicine, and the patient is not sure how long to wait. The fourth risk is that those experienced doctors may be older and may not know how to use the platform. The last risk is the age limit of users. If they are older, they will be inconvenient to use or don't know how to use it.
This is the prototype of our app. The name of our app is Good Doctor Online. This app allows people to get medical treatment online instead of going to offline hospitals. So this is the introduction page of our app. People can either register the new account or log into the old account. And this is the register page. After login, users will be led to the home page. On the home page, a list of recommended doctors will be shown on the top. Also, people can see the special list of different types of disease. On the bottom, people can also see a list of doctors who is available. The next page is the search page. Within the search page, users can search for the doctor by the name of the doctor, special list of the disease, or the time they want to meet with the doctor. By clicking the name of the doctor, users are able to see some detailed information about the doctor. This is the doctor's detail page. In this page, users can go through some basic information about the doctor, including which hospital he or she is working at, the specialist information, and even reviews from their past online patients. We hope we are able to enhance users' trust regarding to online medical treatment by providing those detailed information. After selecting the doctor, users still need to choose the time they want. There are different ways for audience to communicate with the doctors. They can either use video call, audio call, or just message the doctor. And here are the samples of video call and message site. After communicate with the doctor, our app also provides medicine delivery service. Doctors can give a list of medicine online. Then our workers will deliver them to users' home directly. Before the delivery, users have to finish the delivery information page first. In this part, users are required to provide the name, mobile phone, and their address. After finish all the information, the system will generate the list of medicine and the total cost automatically. Users can pay the fee through either Apple Pay, credit cards, or PayPal. After paying the money, users can check the delivery information.